presentation is on the Affordable Care Act. I'm Hadley.
I'm Destiny.
I'm Carrie.
And I'm Maddie.
So our broad topic was policies that ensure equitable access to healthcare nationwide. Within that topic, we chose to focus on the Affordable Care Act. This is also known as the ACA or Obamacare. The Affordable Care Act was passed in 2010 during President Obama's presidency. The main goal of this policy was to expand access to health insurance and move the United States towards universal healthcare coverage. The ACA also shifted the healthcare's focus more towards preventative care, care coordination, and community-based health services instead of only treating illness after it occurred. Some important benefits of the ACA include protecting patients from being denied insurance coverage due to pre-existing conditions like diabetes. You can stay on your parents' health insurance until age 26, and providing tax credits to help lower income individuals afford health insurance.
So for our research methods, we mostly used EBSCO and PubMed for our databases. We use search terms such as the Affordable Care Act, ACA and patient outcomes, Medicaid expansion, ACA and nursing, healthcare access, health disparities. We looked at peer-reviewed articles, and we focused on articles published within the last 5 years, with an exception of one that was published more early after the ACA was passed, just to get that perspective. And then we focused on ACA outcomes, nursing impact, or healthcare access. We reviewed the titles and abstracts for relevance to the topic. And our findings were organized by key themes such as patient outcomes, nursing impact, healthcare access, remaining disparities and challenges. And then we synthesized all of the evidence to answer the research question and evaluate the impact of the ACA.
So when I was looking into different evidence to show the impact of the ACA, at first I looked at what insurance rates were before. They were around 40 million Americans that were uninsured, and after ACA implementation, 20 million uninsured Americans gained health insurance, which is great. And looking deeper into that question of uninsured rates before and after, I reviewed a 2017 article and a 2021 article that examined ACA's impact on insured status among Americans, and this used national survey data. It found overall that uninsured rates dropped significantly, but there were still disparities among populations like Black, Hispanic, non-citizens, and low-income populations after the ACA. Roughly 10.6% of Americans still remain uninsured, which is a continuing barrier. And looking at the level of evidence here between these two articles, both of them were peer-reviewed, and one was systematic, the other was an observational study. And overall, they have about a moderate to strong level of evidence between the two of them. Neither of them capture uninsured rates beyond 2021. There is policy changes that have happened recently that we are not accounting for here because there is less evidence and less funding for research in that area. And neither fully accounts for state-by-state variation. Overall, we see that the ACA significantly improved uninsured rates among uninsured Americans, but we still have a problem. 10.6% of Americans remain uninsured. Here is some reasons people may remain uninsured even after ACA implementation. Coverage might be not affordable. It's also difficult to sign up for healthcare and figure out how to use the website if you're not literate in using the internet, or if maybe English isn't your first language, which is true for a lot of Americans. Overall, there are many reasons people continue to be uninsured. And when I looked at utilization of care, I found that access to healthcare and preventative services significantly improved when I looked at these two studies, one in 2023 and the other is the same one from before, from 2017, that looked into early implementation and how that immediately impacted patients and their utilization of care. Overall, cost barriers reduced, delayed care reduced, ER visits reduced, which is great, and consistent sources of care increased. Overall, there was more routine and preventative visits, which is awesome because that prevents long-term, more costly complications. Despite improvements, there is still cost concerns, provider shortages, and unequal access to preventative care. This diagram shows some different reasons that people might not be able to utilize the care that they have, even if they have a health and insurance plan through the ACA. Looking and comparing at the two different articles, I looked at the 2023 one and the 2017 one. One looked at patients, the 2023 one looked at patients 50 to 60 post-ACA, and the 2017 one specifically covered low-income populations, so they differ in that, so that can be a barrier to comparing them. They have different populations, time frames, and obviously that state variation really gets in the way of comparing articles and data. Overall level of evidence is about moderate, which is still good. And the comparison to policy, it successfully expanded access to preventative care and primary care services. So people are utilizing that care, but there's still barriers for people like there always is, and things we need to work on. Finally, like I've been mentioning, one key thing that is difficult to account for is that states either chose to expand Medicaid or not expand Medicaid post-ACA. Here there's the green states that chose to not expand Medicaid and the blue states that chose to expand Medicaid with the ACA. And I looked at one study to just see how that impacted patients. It was done in 2023, and it compared expansion versus non-expansion states and how that impacted healthcare access, behaviors, and outcomes. Overall, it found that expansion states saw way better health outcomes and improved access to care, as well as preventative care like HIV screenings, and non-expansion states saw persistent gaps. So, yeah. And when I compare this to policy and the goals of the ACA, expansion advanced ACA's core goal of equitable access, but non-expanded states continue to fall short. And there are some limitations to the studies, mixed findings, not capturing full range of population, the period, and it's difficult to compare states when they have different timelines and things like that. Overall, we got a moderate to strong level of evidence showing that the ACA was impactful in its policy.
Okay, so for how the ACA improved health outcomes, research that we've talked about has shown that the Affordable Care Act improved health outcomes in several important ways. One of the biggest impacts was increasing coverage, which helped people access health services that they had not been able to afford before. It also improved access to preventative care, including routine checkups, screenings, and vaccinations. Preventative care is important because it helps detect problems earlier before they become more serious or more expensive to treat. Another major benefit was earlier diagnosis and treatment of chronic diseases like diabetes and hypertension. One of the studies found that Medicaid expansion helped patients with diabetes access healthcare services and manage blood glucose complications more effectively. Community health centers also played a major role in helping patients receive preventative care and ongoing treatment. Research also showed that more people were able to access HIV prevention medication known as PrEP after Medicaid expansion under the ACA. However, the studies did note that some disparities still exist, especially among vulnerable populations and women facing barriers like transportation, stigma, and lack of education. Overall, the evidence suggests that the ACA improved healthcare access, preventative care, and chronic disease management, especially for low-income and underserved populations with that Medicaid expansion.
So once this act was put in place, it kind of shifted what was expected of nurses. They were no longer viewed only as bedside caregivers focused on treating a diagnosis. Instead, their role expanded to caring for the patient as a whole. They now play a key role in ensuring appropriate follow-up care and making sure patients have the resources they need when they are discharged home. Their responsibilities include discharge teaching, medication education, monitoring patient outcomes. They also connect patients with community resources and support services to help promote progression of care. In addition, they advocate for patient safety, access, and quality of care throughout the healthcare system in general.
So for remaining challenges, although the Affordable Care Act improved healthcare access for many Americans, research shows that several important challenges still remain. One major issue is that millions of people are still uninsured or underinsured, especially in states that did not expand Medicaid. Coverage gaps continue to affect low-income individuals and families who may earn too much to qualify for Medicaid but still can't afford private insurance, kind of leaving out the middle class there a little bit. Another ongoing problem is that healthcare affordability. So for even for people with insurances, high deductibles, co-pays, and medication costs can still prevent patients from getting the care they need. So even though a lot of patients are now having insurance, they're not going to the doctor because they're afraid of that medical debt that they could incur even though they do technically have insurance. Provider shortages are another challenge, especially in rural and underserved communities where access to primary care providers and specialists may be limited. The research also showed that health disparities still exist among vulnerable populations. So for example, like women seeking HIV prevention services still do continue to face barriers such as transportation issues, stigma, lack of education, even after the Medicaid expansion improved insurance coverage. So another criticism of the ACA is that even when people gained insurance coverage, they still struggle with that affordability like we talked about. So super high deductibles and out-of-pocket costs, even if the insurance plan itself might be affordable. So even though we're insured, we're unable to afford to do anything for our health. And then while the ACA made significant improvements in healthcare access and preventative care, the evidence does suggest that continued policy changes in healthcare support are still needed to address affordability, access, and health quality. And then for the Healthy People 2030 connection, some goals of Healthy People 2030 are to increase access to healthcare, increase access to preventative care, reduce health disparities, improve chronic disease management, and improve overall health outcomes. It's a national public health initiative created by the U.S. Department of Health and Human Services. So they are hoping to increase the health and well-being of people over the next decade. And then the Affordable Care Act does support many of these goals. By expanding insurance coverage and Medicaid eligibility, the ACA helped more people gain access to healthcare services. It also increased access to preventative care and services like screenings, vaccinations, and routine checkups, which helps identify health problems earlier and improve long-term outcomes. It also helped improve healthcare access for underserved low-income populations like we talked about, which does connect directly to Healthy People 2030's focus on reducing health disparities and promoting health equality. And then overall the ACA does support many of these national public health initiatives identified by Healthy People 2030 by improving access to healthcare prevention and population health.
Okay, so now we have the overall just conclusion, main takeaways. As we've already talked about, the ACA increased health coverage for millions of Americans around the world, expanded Medicaid, improved access to health care as well, provider shortages continue in rural underserved areas, which is a challenge. The ACA helped overall improve access to healthcare prevention and population health across the U.S. With that being said, we also have implications for nursing practice. So nursing plays a huge role in patient education and prevention care when talking about and navigating insurance coverage and healthcare resources. Evidence-based care, nursing care helps improve long-term patient outcomes as well. And the impact on patient care is the increased access to routine and preventative services, improved chronic disease management, as we've talked about, and just reduced delayed care due to cost barriers. The future implications and final thoughts. So we still have a lot of remaining challenges with the ACA, healthcare costs and affordability remaining concerning. Insurance coverage gaps still exist in some states, and the provider shortages that we talked about. For future implications, we want to continue healthcare policy reforming is still needed, and knowing that nursing will always continue to advocate for accessible evidence-based care is really important. So final takeaways, although there are still a lot of challenges remaining with the ACA, overall, the ACA has made lasting improvements in healthcare access, prevention, and overall public health. And here are references.
Thank you.
Thank you.
I was just making
Is
sure
that-
16, okay, perfect.